Hello, this is Dr. William Berger of Northeast Medical Practice. We are a primary care, weight management, and aesthetic medicine practice located in Great Neck, New York. And today I have the pleasure of speaking with our exercise physiologist, Peter Cummings, who is a very welcome addition to our obesity medicine program here at Northeast. Peter, why don't you start out by telling us a little bit about your background and how you became involved in health and human performance?
In my late 20s, I was actually thinking about going into medicine or some type of health field. And what I was learning in college at that time were some of the basics about nutrition and physiology. And I just happened to be working out in a gym and then working at a gym, and very quickly realized that what I was learning could be applied to the care of people's health or restoration of health, getting fitter. And simultaneously, I was dealing with the chronic disease of my grandparents, and I was the oldest grandchild. And I saw how the healthcare system worked, and I started to get a good taste of it. And I think I made a decision at that point that illness care wasn't really what I wanted to do, and I wanted to be more on the preventative side. And I guess it just took a life of its own from that point.
Okay, wonderful. As you know, here we're all about prevention as well, with weight being the mother of so many of the chronic diseases that we deal with in the civilized world. So very much on board with you there. So tell me how you work with the patients that we refer to you and what they can expect when they begin to work with you.
Well, I'm working under your general supervision, using the clinical picture that you establish, and from there, I, in much the same way you would do, is I make some type of assessment, assessments objectively off of cardiorespiratory fitness, and how they move, how well they move, if they move with pain or dysfunction or just compensation, or they move well. And I like to talk to the patient a little bit and hear from them what they're really looking to achieve. And that helps me to create a more personalized and appropriate exercise prescription that's going to fit into their life. And the appropriateness also makes it safe.
Okay, safety, of course, being paramount. We want our patients to start to move more, but we certainly don't want them to be sidelined by injury in the process. Also, so we do body composition analysis here in the office, which gives us a picture of lean mass, muscle, and its distribution in the patient. How do you utilize that within the creation of your exercise prescription?
Well, that's a great point. Your commitment to understanding the comprehensive nature of lifestyle and how it affects your treatment plan, the outcomes of the patients, their quality of life, ties in with what I do. And while I only really focus on the exercise component, what you just mentioned was lean tissue, and maintaining lean tissue or gaining lean tissue is a critical aspect of metabolic health, while simultaneously reducing that visceral adiposity, which is the fat that most of us don't see. We look at our subcutaneous fat and we don't maybe like the way it looks, but that visceral adiposity is really where the inflammation and a lot of the negative effects of being overweight come from. And exercise really taps into those two functions. So, with you working on the medical side and the nutrition side, and my work with maintaining or even building lean muscle tissue, we can really put a big dent into that visceral adiposity.
Absolutely, absolutely. And yes, as you mentioned, super important, the visceral adipose tissue, fat deposition of the pancreas, of course, interfering with insulin production by the islet cells and increasing risk for diabetes in the liver. Fatty liver can lead to cirrhosis, fibrosis, and actually one of the most common reasons people get a liver transplant in this country now is due to that progression. So very, very good point on the visceral adiposity. And how would you explain the importance of exercise to health beyond what we've already gotten into, but to our patients with their chronic conditions?
Yeah, I'm actually working on a course for medical providers to discuss this very subject, and I think the underlying theme it's more of a how-to course of how to do what you and I are now doing for your patient population in other practices. But the underlying theme of the why, why is this important, is cardiorespiratory fitness is actually the very best biomarker that we have to establish risk of mortality. And it just seems very clear that the more fit you are, the more resilient you are to everything that life throws at you, whether it be stress or environmental stress, psychological stress, illness, infection, trauma, injury. The people that are fit have the ability to heal and get back on their feet faster. And then from a practical perspective, if that's not enough, people that are fit just have a higher quality of life because the fitness allows every activity of daily living to be assessed as easy. So these people find it easier to move, lift groceries, lift their grandchildren, play, dance at weddings. All of these things just become just more simple and more manageable. And when you're not fit and you are usually not healthy and not living a high quality of life, in large part due to your lack of fitness and all those other aspects that are tied in with it.
Absolutely, absolutely, and longevity as well as quality of life very tightly correlated, both with aerobic fitness as well as muscle mass.
Yes.
Um, okay, and um, so your program with us is remote, and tell me how that works for the patients that we work with together.
Well, I've been working remotely with my athletes for almost 25 years now, and um, one of the benefits for me is I get to do it conveniently wherever I am at.
Hmm.
Um, but for the individual that is using these services, I'm meeting them where they're at as well. So as long as they have internet access, they have a mobile phone, they're capable of communicating with me, learning from me, and uh, letting me guide them through the process. And getting feedback and being able for us to monitor their progress is a big part of that. And then as far as the assessment goes, you know, uh, one of the things I really like about the remote assessment that we give patients is this is an assessment that they can now do for themselves on a regular basis. So what we're teaching them with these two assessments that we do to assess their cardiorespiratory fitness and their movement competency is a benchmark for them. So as they start to do the things that you and I are asking them to do, they can reassess themselves and see for themselves that the work that they're putting in, the commitment they're making to these changes that we're asking them to make, is bringing concrete objective measurements. So you talk to patients every day, and they love looking uh, better. They like fitting into clothes they haven't fit into a long time. The compliments they get from people they haven't seen in a while. These are still very important, valuable things for the patient. But to also see objectively that, wow, I couldn't walk that far just a couple months ago, and I didn't move like this a couple months ago. I was incapable of that. It provides them an objective measure so that some days, maybe when the scale doesn't move, um, that they're not disheartened. That there's other upsides to this, and that's a big part of the remote part is providing them the tools to assess themselves, but also to give me the ability to prescribe safely. And then moving on, it's got to be as convenient as possible for people to continue to use the services.
Of course, we're all exceedingly busy, and in general, we try to meet our patients where they are, wherever they are on their metabolic health and weight journey as well. So, giving them the option to do it from where they physically are is also, I think, uh, a great benefit to our patients. And you just mentioned safety a moment ago. So, can you tell us a bit more about how you ensure that the exercise prescriptions that you give our patients are safe for the individual.
Uh, One of the lessons I'm working on right now for that course I was just mentioning
Hmm.
was about this exact conversation. Is as a medical professional, you know that you would never um, just say, "Oh, I give out a lot of hypertension medication, and this guy looks like he could be hypertensive, so I'm probably going to give him hypertensive medication too." Right? That you would take his blood pressure and assess whether he has hypertension before you would consider that.
Of
And
course.
that's exactly what those remote assessments allow me to do. Is first they objectively allow me to say, well, this is where the person's cardiorespiratory fitness is currently, and this is where it classifies, on a scale of very poor to superior. And then the movement competency allows me to do two things. First, it identifies dysfunctional movement patterns, and just for an example, most people don't realize that a very common dysfunctional movement pattern is shoulder mobility, and that's where on that assessment I ask them to reach behind their back with both arms to see how close they can get these things together. Well, that's very common that people can't do that. Excuse me. And And if you can't do that, then you have no right lifting things over your head. But most people don't know that. But if you just decided to take up an exercise program on your own and you went to your local gym, there's always a machine that you sit on and you can move things over your head, right? The shoulder press, the military press, and or dumbbells where you're lifting that. Well, for these individuals, that is a risky move. That is a move that could evoke injury. So the ability to assess remotely and work with the patient allows me to keep it safe. And then, as far as an effective part is, usually when it's safe, it's effective, for one. But the other part, as I mentioned, I really like to talk to the patient, because I think the other part of poor prescription is often just being generic in nature, but also not taking into account what the patient has available to invest. And I'm a big proponent of trying to do more with less, and I mean more outcome, less time involved. And many of the patients, especially the patients I've been working with from your practice, they're benefiting from 15, 20 minutes of exercise. And that could be broken up into two sessions. And I think, as you could attest to, that it seems like the patients are enjoying the prescription as well. And I think enjoying it
Absolutely.
is also a way to make sure it's effective, because people will keep doing it.
Of course. Of course. And so, how do you build that trust and maintain communication with the patients as they go forward through the program?
Well, twofold. One, I do believe that these conversations that I get to have with people helps them to realize that there is a team that you built around them, right? So they have your medical assistant and your coach, and they have you, and now they have me, and that helps them to realize that they're not alone in this journey. That they have some professionals they can trust, and get information from, that they don't have to just take random information off the internet or from friends.
Mhm.
Um, and then, as far as maintaining the communication, uh, again, those devices that we have set up and provide the patients allow them to message us directly. So I try to get back to them in less than 24 hours, often within minutes. And I think them knowing that we're on the other end, paying attention to what they're doing, um, is very important for them, to be able to get quick uh, feedback from what they're doing. And then lastly, I think actually the most important thing, and people have asked me for years, that I've been self-employed for those 35 years as well, and they say, well, how do you advertise? And I think this ties into this last point, which is results, right? When someone comes to you and asks you to help me with weight loss, help me to get fitter, help me to get faster, um, and you do that, people notice, not just the person that we're working with, but other people around them. And those people talk to other people as well and say, this is where I went, and these are people I trust. And you know how that is in today's today's world, the reviews that we get in our internet persona is really important, but so is the persona of what the patients believe in us.
Absolutely, there is nothing quite like word of mouth, a direct referral like that. Absolutely. So maybe you can talk a little bit about what kind of results we've seen in our patients, and that might give our patients or potential patients who are watching this some idea of what they might expect from working with us.
Uh, what's the best way to describe it? Surprisingly excellent. It would be a good way to describe it. The people that need exercise the most are the people that benefit from it. The people that need nutrition advice are the people that benefit from it. So a
Mm-hmm.
lot of times people get in a rut and they start to, have doom and gloom, and they lose hope. And I feel like that's the worst thing that can happen, is the loss of hope. So if you're listening to this and you know someone, or you're that person, or you're just starting out and you're wondering how far you can go, I would say the sky's the limit. I tell a story of a patient that started with us, and 3 months into it, when we sat back down, because we originally had a 3-month program, she asked, or we asked her, "What do you want to accomplish now?" And she went blank, because when she started, what she was thinking was possible had all been accomplished. She was off 8 different medications, had lost more weight than she ever thought, was feeling better, looking better than she ever experienced. So um, sometimes it's difficult to set appropriate goals and have a vision of what's possible from the perspective that you're at, but you have to have hope. And uh, I, I have been doing this a long time, and what you've set up for your patients with me, and with other people, this team you've surrounded them with, is very rare. So I would doubt that anyone has had experience with this type of treatment plan, this type of treatment period. And I think they need to give it a try and give it a solid effort, and they will be shocked at what can happen.
Well, we're very pleased thus far, and we're really trying to give our patients the most comprehensive kind of program, and really address all the different aspects of lifestyle medicine to really help, not just with their weight, but with their overall health. Uh, Peter, are there other things that you'd like to, additional things you'd like to bring up before we come to a close?
No, I think that last point's important. I'm excited to work with you and the rest of the team at Northeast, because it enhances what I do as well. Um, having a physician of like mind that I can communicate with, and the patient can communicate with, and we can be on the same page, and go back and forth in the EMR and through messaging, to make sure that that what the patient is hearing is the same, and what we're discussing with the patient and what the patient is prioritizing is known amongst the team members. So when I'm able to write a soap note about what my assessment has come up with, and why I'm proposing the plan that I've proposed, and you as their physician get to read that during their clinical visit, it really puts us all on the same page, and patients love that. On the other side, I'm working with patients on my own, and I had a patient recently lose 25 pounds and normalize his blood pressure, and he went in for his annual visit, and his primary care doctor didn't notice that he had lost 25 pounds. Never mentioned it. Never
Mhm.
mentioned that his blood pressure was normalized. And in fact, started picking on him about his LDL, despite the fact that his LDL had gone down, as did his total cholesterol, and his HDL went up 30%, and his triglycerides dropped in half. Now, I know the patients may not hear that, but if you understand that from a patient perspective, that there are things that your doctor tells you we need to watch, and there's things that you'd like to achieve to make yourself healthier, and you do those things through hard work, and then your doctor doesn't even mention it, that's not what's happening at Northeast, right? This is a team that is in constant communication, focused on the patient and their goals, and I'm just thrilled to death to be a part of it.
Well, thank you so much for those kind words. We really try to give our patients enough time with each of us as well, which I think is so important, and can help us avoid that kind of story that you were just telling. Well, thanks so much for taking time to speak today. I'm really happy that you've joined the program. I'm learning a great deal from you as well, and all of your expertise in your discipline. And I really look forward to how we're going to collaboratively help our patients going forward.
Onward we go.
Sounds good. Okay, well, this has been Dr. William Berger at Northeast Medical Practice, speaking with Peter Cummings, our exercise physiologist. If you'd like to reach out to us, you can call the office 516-604-3418. Find us online at northeastmedicalpractice.com or find and like us on social media. And until next time, be in good health.